Aspirin is an essential component of peri-PCI patient management, but not every patient gets it, and as a matter of fact, that's one of the issues being addressed in this particular discussion. We're with Dr. Mohammed Kenaan of the University of Michigan Health Science System in Ann Arbor. The presentation here at ACC 13, lack of aspirin use prior to PCI is relatively common and strongly associated with increased in-hospital mortality. Besides a wonderful title, why did you do this study, first off, before we get into the details?
Basically, it was a surprise to us. We were looking at some data. As you said, it's a common medication. It's an unexpensive medication, a medication that has been the cornerstone of therapy. And it was surprising to see a couple of cases of patients that did not receive aspirin before the procedure. So we decided, are we missing something? Should we look further into it? And that was what triggered our study. There has been some data in the past that very indirectly suggested that there is a good subgroup of patients that do not receive aspirin, and that was further reason to look into it.
So, Dr. Kenaan, what did you find when you looked at it?
So basically, we found that a significant subgroup of patients that receive PCI or that undergo PCI do not receive aspirin as recommended by ACC, AHA, and ESC before the procedure. About 7% of patients in the registry,
clinically significant.
Very significant. Of the 7%, about 10% or 11% had a documented reason. Some of them were because of hypersensitivity or an allergic reaction to aspirin, but other reasons spanned anywhere from presenting in a state that some people perceive as not being does not allow receiving aspirin, such as an arrest or in a shock state. Some people did not receive it because they had a history of GI bleeding in the past. So there were several reasons, but only about 10% of these patients had a documented reason for not receiving aspirin.
For those patients who didn't, for that 7%, what was the outcome?
The outcomes were worse in-hospital death and worse rate of stroke.
So what's the take-home message here?
So the take-home message is that aspirin is recommended by ACC. It's a class 1 recommendation by ACC, AHA, and ESC before PCI. There is a good size subgroup of patients that do not receive it, and patients who do not receive it have worse outcomes in terms of in-hospital death and stroke, and therefore we should really have more effort to optimize aspirin use before PCI.
I mean, because of all the good modern therapies, you might think that plain old aspirin isn't really needed that much anymore, but perhaps this suggests that it really is.
Yeah, actually, the way I thought about it is that aspirin is proven that it's helpful, and at some point maybe everybody thinks, oh yeah, everybody knows about it, everybody does it, but
or they're covered by something else and we don't have to worry about it.
Yeah, and that's not the case. Our study strongly shows that they should still receive aspirin prior to PCI.
Well, Dr. Kenaan, thank you very much. And I also would like to say thank you to everyone who is paying attention here, and make sure that you check out CardioSource World News for our coverage from the ACC 13 meeting in San Francisco. I'm Rick McGuire.